everyone, and welcome to Oh Just Pet Podcast. This is February, and we're here to bring you some exciting information about our pets. I'm here, Maria Lee Driver, with, I'm a brand new pet owner, Fresh Mink Pet, and I'm here with Dr. Andrea Dunnings from East Atlanta Animal Clinic. And we always come in and we give you guys insights on your pet. So we
Absolutely.
get excited talking about these pets like cat, dogs. They're your pets, and we just want to give you guys some information. And as I'm a brand new pet owner, yes, I created a product, but the product is in a bottle. The pet isn't. So I had to go to the expert so I can find out how to take care of my pet. And that's when we decided to say, let's come together. You trying to learn. I have some things that need to be said, and people love it. Of course, she's the expert. And we just merged this together. And now we got Old Just Pets. So thank you for joining us because we come on every month on a Wednesday at 8 p.m. So we're looking forward to you seeing our information, and we got nuggets to drop today. Oh, we do. And I just want to thank Dr. Dunnings for being here. Dr. Dunnings, will you introduce yourself and let everybody know who you are?
Yes, absolutely. Hi, everyone. Thank you for tuning back in again with us. I'm Dr. Andrea Dunnings, and I own East Atlanta Animal Clinic in East Atlanta Village. I'm one of the co-owners of another location in Decatur, Church Street Animal Hospital as well. And like Maria said, we're here every month just to bring you some information about pet care and taking care of your pet, dog or cat, and just how to make a difference in the life of your pet, because they make such a difference in our lives on a daily basis. So we want to take care of them as best as we can, right?
That's
So
right. That is correct.
yes, absolutely. And I was telling
So
Maria that February is National Pet Dental Health Month, and so we were
now, who
talking.
knew that? Who knew that the dogs have a month? They have a dental month. Like
They have
what?
a dental month. They do. And the reason for that is because a lot of times people don't understand the importance of taking care of their pet's teeth, but it's very important because their teeth are made out of the same dentin and enamel structure that our teeth are made out of. And when you go to the dentist, what does the dentist tell you, Maria? What are you supposed to do to take care of your teeth on a regular basis?
You need to brush your teeth. You need to brush your teeth every day, especially in the morning, sometimes in the middle, and then at night. You need to take care of that enamel so it'll take care of you.
Exactly. And just
Yes,
because,
ma'am. So you telling us we got to do the same thing with our dogs?
exactly, I am. I'm telling you the same thing. Toothbrushing is like the gold standard for taking care of your pet's teeth. However, many
Wow.
people do not do it. So we're going
Wow.
to talk about some other alternatives to help you with oral hygiene for your pet. But just like we have toothbrushes, we also have specially formulated angled toothbrushes for dogs and cats. You can see this one has a small end
Wow.
and it has a large end for your larger dogs. And then for small pets and cats, there's also these little finger brushes. And this actually has little ribbed ridges on the front end so that when you put it up against the pet's gum
Wow.
line and use your finger in a back and forth motion, you're actually taking off some of the plaque at the gum line and stimulating the pet's gums, right? So brushing is
Wow.
important.
Wow. I have a question.
Uh-huh.
How how old do a pet have to be to start? When is I guess what's the age of a pet, especially a dog or a cat?
Mm.
What are the age of starting to brush their teeth?
So this is where you have to start early, just like when you have a child and the pediatrician tells you you need to
Mm-hmm.
start brushing your kid's teeth. Well, they're having you do it at an early
Mm-hmm.
age to get the child used to the toothbrush and the paste being in their mouth.
Right.
But the parent has to be right there because you don't want the child to swallow the toothpaste and all of that kind of thing. It's a similar situation with dogs and cats. You want to start when they're puppies and kittens. Now, they are born with a set of baby teeth. I shouldn't say they're born with it, but they have a set of baby teeth that come in when they're young. Typically, they'll start teething, around 6, 8 weeks of age. In some cases, a little bit earlier than that. And those baby teeth, or deciduous teeth, as we call them, do fall out, and the permanent teeth come
They
in.
do?
They do.
Wow.
However,
But
you
where's
don't
the teeth?
want
I've
to
never
wait.
seen what where
That's
did it do
because
they swallow the
a lot of them swallow the baby teeth, or sometimes it will
I
fall in
never
the
seen no
food.
baby teeth around here. Oh.
Well, you
I
got
gotta go
music
check
at
out
a
Score.
you got music at an early
Yeah, but
age,
Score is the
and you
baby.
probably just haven't
Oh,
noticed
yes.
Score
It's Score.
losing any teeth. Yes.
No.
Yes. So the
No,
baby
I
teeth
have
do
not.
come
And
out.
Score, he got the little tiny teeth. Oh
Hmm.
wow.
Yes. Yes, yes, yes. So even though the baby teeth are going to fall out, you do still want to get the pet in the habit of having the mouth manipulated and the gum line stimulated when they're young, so that by the time the adult teeth come in, which usually happens around 6 months of age or so, um, they are already used to the owner being in the mouth and to all of the things that need to happen for, that oral hygiene care. Um, but as I was saying, even though we have the specially shaped brushes for the pets of different sizes, you don't want to use human toothpaste. Okay. You do have to get specially formulated pet toothpaste. And this is one of the brands. This is, oops, it's upside down. This is by Verbac. It is a specially
Wow.
formulated pet toothpaste, and it comes in different flavors to make it more
No.
palatable for the pet so that they won't resist it as much. So there's a poultry flavor, there's a beef
No.
flavor, there's a seafood flavor, there's a malt
No.
flavor, vanilla. Yes, because you're
That
trying to
might
make it
stop
as
you chewing on your
pleasant.
fingers thinking, oh my goodness, is this part of the meal? What is going on here? Oh, I don't know. I don't know about
Um,
all of that now. Oh, what? Just think
yes,
about that. I'm putting my
yes, yes,
finger
yes.
in their mouth
You
and
are.
I got this flavor on my finger.
That's
And
right.
they were like, this tastes weird. Is this part what I supposed to be eating
Exactly.
this? The whole finger too?
Exactly. So you're rubbing the brush back and forth on the top and on the bottom of the pet's teeth, to try to stimulate the gum line and get rid of the plaque. But, they also are
Mhm.
licking a little bit of the paste on their tongue. And so they're helping with their tongue to move the paste around in the mouth as well. So they'll get some of the areas that you have not gotten. Um, and like we were talking about, when you go to the dentist, they talk about you brushing your teeth 2 to 3 times a day, and then they still want you to come in and get, cleanings once or twice a year, depending on
Mhm.
how healthy your teeth and gums are. Well, realistically, we know that most people are not going to brush their pet's teeth twice a day. Okay. Toothbrushing is the gold standard
Yeah,
for
yeah.
taking care of your pet's teeth, but most people are not going to do it, right? So we do have
No.
other products that are available to help you with your pet's oral hygiene. So another product that can be used is something like this, which is called Cleansident. It is actually a food additive. It also has a water additive available. Now, the way that these work is that you actually sprinkle it over top of the food. So if you feed the pet twice a day,
Okay.
you spill it over the food twice a day. If you're using a water additive,
Okay.
most times you're putting it in the bowl once a day. But the whole idea is that this actually helps to break the plaque down on an enzyme level. So it's taking care of what the
Mm.
toothpaste is supposed to do by mixing with the food, and then as the pet eats it, it's helping to break the plaque and the tartar down off of the teeth, so that when the pet swallows, most of that hopefully is coming off and going down in their digestive system. Okay. This is
Mm.
available for
Okay.
dogs and cats, and you use it based on body weight. So the bigger the pet, the more you're putting on the food. The smaller the pet, the smaller the amount that you're using. And most of the water additives are not, I won't say they come in as many flavors as the toothpaste does, but most of them have like a
Hmm.
pleasant taste so that the pets won't, smell it and then say, oh, something's in my water, and then not drink the water. Okay. So again,
So it
these
shouldn't have a
dogs,
scent. It usually don't have a scent or flavor. It's just
no.
plain. Is that what you're saying?
Some of them might have like a mild mint flavor to it, but it's not going to be anything that the pet would find distasteful so that it makes them
Mm.
stop drinking the water. Okay.
Mm.
I don't have
Okay.
a sample of this here, but there are also other products. Like there's a wipe available. You know how you have like those little medicated wipes that you can use for your face to clean your face.
Hmm.
Most women know about
Hmm.
those. Well, they do have dental wipes,
Hmm.
and they're little round pads,
Oh.
and you can actually take one of the little dental wipes and wrap it around your fingers and use it to wipe against the gum line and in between the teeth, and just go from, one side of the mouth to the other, and then come down on the bottom and come back to the other side of the mouth, so that you're getting the whole mouth touched, with one wipe. So those are
Wow.
available. And then of course you also have, special chews, that are available. A lot of people know about greenies. CET has been around for a long period of time. They have chews that are made almost like rawhide strips, that you can give to your
Hmm.
pet to chew on a regular basis. Um, we have a
Hmm.
sample of one type of treat here called Dental Life by Purina.
Hmm.
It actually reduces tartar buildup. It's actually in a round shape. And what happens is this actually breaks apart as the pet is chewing on it, and it's creating kind of like a sticky surface, so that as the pet's chewing on it and manipulating it in their mouth, it's actually, some of the stickiness is getting against the teeth and the gums and pulling some of that plaque and tartar away from the gum line. So that's something that's available, and a lot of the chews are designed with that in mind, that the more the pet manipulates it in the mouth, the more they're going to scrape some of the product against the enamel and cause sort of that mechanical pulling of the plaque away from the enamel of the teeth. There's also a diet, or a couple of diets that are dental related, especially formulated for dental health. The way most of those work is that when the pet bites into the kibble, it actually is again acting as a scraping mechanism to pull some of the plaque away
Mm.
from the teeth and the gum line as the pet is actually eating their food.
Wow.
So there are a lot of different
Mm.
options. There is also something called, or a group called, the Veterinary Oral Health Council, or VOHC as we call it. It is a website. And this council actually looks at all of the special products that are available on the market. And it actually has come up with a list of recommended pet dental products. And there is one that is available for cats, a guide that's available for cats. And you can see it's got quite a few items listed on here. And then there is another one that is available for dogs. And again, this is the VOHC. And on the label of these products, you will see that it says VOHC approved.
Mhm.
Okay.
Wow. Uh-huh.
um, because there are a lot of treats out there, and you do have to be careful. Some treats and some diets might not work for every single pet, and sometimes people make a product or and put it out on the market, not realizing that there might be some ingredients in there that might not sit well with certain pets. And so the council really is looking at all of that. It's making sure that it's safe for you to use for your pet. It's making sure that the ingredients are not going to cause any sort of problem in the pet's digestive system or with their kidneys or with their liver or anything like that. So getting that VOHC seal on the product really does mean that it has been evaluated by this particular board of practitioners and people in the pet health industry. So very good
Yeah,
resource for a lot of people.
I got dental treats for music, and at first, because it had like a little minty, you could tell it was an and we got a bag because it was like, let's try this because it's great for the for his gums, and
Mm-hmm.
he did not like it at first, and then as time went on, he started eating them. I need to go
Mm-hmm.
back and get him some more because I found another treat. I can't think of the name of the company, but their treats are also great for the gums and for the teeth, and they
Mm-hmm.
love those. And they're like little sticks, but they're
Mm-hmm.
designed to keep their gums and yeah, they did really good. But you're right, it's just and I found music is my little mean dog.
Uh-huh.
We the last time I was when the last time we was at your clinic, uh your the veterinarian there, she did a great job in getting to Score's mouth and looking at his
Mm-hmm.
teeth and said they were great, but we could not do my music because my music had a muzzle on.
Mm-hmm.
My music still mean he has a muzzle on, so you couldn't get in his mouth. Now I can get into his mouth, but nobody else. Okay,
Yeah.
so I have to monitor his mouth. Oh Lord, because
Mm-hmm.
he's too mean. For so those of you who have dogs that are just the vet, I don't care unless you just knock them out, drug them. You're gonna have to do it yourself. You're gonna have to get in there and check out their gums and keep their gums, or like Dr. Dunning said, provide treats that does the work for you because
Mm-hmm.
that whole finger and the scrubbing the teeth, that's time consuming. And dogs are like humans. Some days, even when I was giving them medicine, even if giving them, sometimes it's good and then sometimes it's just bad. Like, I don't want to be in their mouth. I want the dentist in mine, so I know they will want my finger in theirs.
There you go.
So please look
Some
at
pets
those
tolerate it
options.
and some don't. Yeah. So you have that's why there's so many options so that you can try to
Yeah.
find and we can help you try to find the one solution that's going to work for your pet. Because a couple of things that you brought up in your example with music, um, you as the pet owner are in the pet's vicinity or around them every single day, for however many hours you guys
Yes.
are together. But one of the things that is
Right.
important is because you're not taking your pet into the vet's office, on a monthly basis, when you're actually brushing them or
Right.
sitting there, holding them and you're just kind of playing around with their face or giving them, smooches or hugs or whatever, you can actually pull the lip up and look at the teeth and kind of see for yourself
Mm-hmm.
what are the teeth looking like.
Self. That's
Because in
right.
this
Mm-hmm.
model, you can see this is like an outline of a pet's mouth here on both sides. But this is
Wow.
actually
Wow.
showing more of a healthy gum line and healthy enamel, more white, pristine looking. This is what the pet's teeth and gums should look like. But if you get to a point where you're not
Mm,
doing anything for your pet's dental health, by the time they get to be 7, 8, or sometimes 10, 11, 12 years of age, then you're looking at this scenario where you've got rotten gums, gingivitis. How many times have you been to the dentist and they've told you you've got a mild case of
wow.
gingivitis? So
Wow.
it can be mild to severe where you're starting to get this brown plaque stuff
It's
building
just
up.
like ours. The teeth start to
Exactly.
decay.
Exactly.
Wow.
Or worst case scenario, you get like this upper arcade here where the teeth start falling out because the bone loss has gotten to the point where the gum lines are so red and irritated, the periodontal ligament is no longer holding the teeth in the mouth, and so the pet starts to lose teeth. And then you end up with pets who sometimes are face shy because their mouth is hurting, or, they're starting to drop the food out of their mouth, or, when they're chewing the food, sometimes they're cocking their head to one side because that's the only side that doesn't have pain and discomfort when they're chewing the food. Or worse yet, you start to see blood mixed in their saliva because the gums are bleeding because they're so
Oh,
raw and
wow.
irritated. So, dental
Mm.
health in pets is extremely important. And I can't tell you the number of times that people have said, I don't want to do a dental cleaning on my pet because it requires general anesthesia. Let's really talk about this because this is a
Mm.
big pain point
Mm.
for a lot of people. A lot of people do not
Okay.
want to put their pet under anesthesia because of the fact that the pet has to go under a gas anesthetic in order to get a full, really, really good dental cleaning. Okay. The
Wow.
importance of
Okay.
the anesthesia is that when you go to the dentist, they actually can tell you to hold your mouth open. And you can actually sit there with the suction tube in
Right.
your mouth that's taking all the water spray out of your mouth.
Exactly.
You can't do that on an
Uh-huh.
awake pet.
Uh-huh.
What are they going to do? They're going to
No, you
chew
cannot.
and they're going to bite down and they're going to gnaw and they're going to wiggle and they're going to
Uh-huh.
squirm. And when we're doing a dental cleaning on the pet, we're using the same scaling instruments, we're using the same water supply, we're using the same probing instruments that dentists are using on you when you go to the dental office. So, in order to be really
Wow.
effective with this, it requires that we put the pet under general anesthesia. It's the safest, it's the quickest way to get the teeth clean without harming your pet and without the vet professional ending up with, bites and cuts all over their hands because they're trying to
Mhm.
manipulate a pet's mouth and the pet doesn't understand what's going on. And then add to that the fact
Exactly.
that when a pet is painful, and you go to probe something, a spot where they've got a loose tooth or a tooth that's
Exactly.
bothering
Oh, they
them.
gonna bite you. They gonna bite
Exactly.
you.
So we don't want to cause them
They
any
gonna
pain,
bite
and we want to
you.
help alleviate the pain
Right.
as best as possible. And so extracting
Mhm.
teeth requires the pet to be under anesthesia. We can't just go in there and yank the tooth out. We go in, we provide
Mhm.
numbing anesthetics in the gum line, just like when the dentist applies that anesthetic gel to your gum, and then they actually shoot
Mhm.
you up with the
Mhm.
Novocaine, and you're sitting there like, oh my gosh, I can't feel
Mhm.
half my mouth. We do the exact same thing for pets because we are trying to be as pain free as possible, not just during the procedure, but also after the procedure as well. Okay. So I don't want
Wow.
people to be scared about having their pets' teeth cleaned because you would not believe the number of pets that we see, especially the small Yorkies, the Chihuahuas, the ones that have small
Mhm.
mouths and a lot of teeth crowded into a small space. You will not believe the
Mhm.
number of times that we see a pet at the age of 12 or 13 and the complaint is they're not eating and you open up the mouth. First of all, sometimes you can smell the mouth when you first walk in the room without even opening the pet's mouth. And then you open the
So,
pet's
is
mouth.
that why some pets have is that why some pets have bad breath?
Yes, that's because they are actually starting to have
Wow.
dental disease. They are starting to have gingivitis, and
Oh.
it's starting to cause plaque accumulation that forms that hard brown tartar. And they can't just paw at their
Wow.
mouth and get that stuff off. It requires a dental cleaning. But in these dogs that come in
Wow.
for the first time and they're getting a dental cleaning at the age of 12 and 13, a lot of times we're removing multiple teeth because the teeth are so diseased, they're basically just floating in the gum. They're not adhered to the bone anymore. So the pet, every time they
Oh
get
my
ready to eat, the teeth
goodness.
are moving. And then after the dental cleaning, guess what happens? You call and check in with the pet 2 days later, they're like, oh my gosh, it's like a different dog. And then when they come back in for their 2 week follow-up check or 10-day follow-up check or whatever the follow-up time frame is, they're like, oh, they're like a puppy again. They're running and they're playing and they're eating and they wanna be more engaged. That's when the owner usually realizes how uncomfortable the pet was. It's after we've gone in
Mhm.
and taken out all of those diseased teeth. So we don't want your pets to get to the point where they're losing
No.
12, 13 teeth at one time when you can get a dental cleaning done once a year and stay on top of your pet's health in addition to doing all these things at home, like your wipes or
Mhm.
your food additive or your toothbrushing or your special treats. Okay? So, if we've
Wow.
learned nothing else this particular session, it hopefully should be the importance
We
of
have.
taking care of
Yes.
your pet's teeth. Everybody okay?
Everybody's okay. I learned a lot. I am oh my goodness. I'm so glad because I saw that in the store and I never asked you about it, but it's like, but it's on the shelf. I mean, they're
Mhm.
there for a reason. So I said, well, let me just try these. But that is
Yeah.
very important because I have small dogs and they got tiny teeth. So I can
Yes.
only imagine that will just be a mess. Oh
Yes.
my goodness.
Absolutely.
And their breath don't
Absolutely.
stink. So I will definitely be paying because I'm like, oh, my dog breath don't stink. But I've been around dogs who have horrible breath, but I thought maybe
Yes.
it's because it was that breed of dog, or some people say it's what you're feeding the dog too. So, and I'm like, okay, maybe that's the dog digestive system. But now you telling me that they got bad breath is probably because they got diseased or they got some teeth that need to be removed. And humans are like that.
Exactly.
Humans are like
Exactly.
that too. If you have decayed teeth, I promise you, if someone said you got bad breath and you brushing and you gargling, you doing everything and it's not working, something in your mouth is not right.
Exactly.
All right.
Exactly. And I can speak from my own experience because I've always been one of those people that ever since I was a child, every time I go to the dentist, that there's something, some kind of issue, chronic gingivitis, this, that, and the other. And they want me to come get my teeth cleaned every 3 months, yada, yada, yada. But I have learned over the years that the more I stay on top of what it is I'm supposed to do, the less invasive my dental procedures are when I go to the dentist
Yes.
office. And
Yes.
that's what we're trying to
Yes.
do. We're trying to stay ahead of the game so that you can help your pet stay as healthy as possible. But also, guess what? It saves you more money in the long run, because if you're
It
able to
does.
buy a bag of treats and give your pet a dental chew, once a day or a couple of times a week and help really freshen their breath and get rid of the plaque and the tartar, then guess what? That's helping to reduce the amount of issue in the pet's mouth
Yes.
so that when they have the cleaning, they're able to keep more of the teeth. So it's
Yes.
a full circle type of situation for humans and for pets.
Well, Dr. Dunnings, I want to thank you so much because this podcast this time was fully packed. So for those of you that didn't get it, you need to watch it again. So I just want to say thank you as always with the knowledge and the graphics and just describing why it's important that February is National Pet Dental Health Month. And I want you
Absolutely.
guys to go out and get the necessities that you need for your pets. You need to do it. Take care of those miles because that's another vet bill that you don't want to have to deal with. Because what she just said, all I saw was dollar signs, and dollar signs. If you if you don't go get them shoes, I'm here to tell you, I'm gonna go get an extra bag now. What I know. See, it's the unknown that gets you. And as a brand new
That's
pet
right.
parent, those are some unknown things that I didn't realize. I just got it because I saw it in the store. But now that I understand, you don't have to worry about me anymore. They be chewing every day. I'll be chasing them around the house,
Absolutely.
making sure they're eating it. So,
Absolutely.
well, with that, we would love to see you guys the next time. Join us on Old Just Pets as we're giving you all the information we could possibly give you from the expert and me sharing my insight on my little ones that's running around here as a brand new pet parent. Thank you guys so much for joining to Old Just Pets. See you the next time.